like it sounds like two people in the room. Thank you guys for coming this evening. This is a very special day, moment for Art Forms Foundation. My name is Ebony Easley. I'm the founder and executive artistic director for Art Forms Foundation, and we are Oklahoma's first arts and wellness nonprofit here in the state. Today we are kickstarting off our art therapy behavioral intervention initiative, and this is just a long-term plan we have that's rooted in art therapy philosophies. I don't want to talk too much about that because I'm actually not a licensed art therapist, but I really appreciate and have done a lot of deep research about the topic, and I feel like it is very much so the solution that we need in order to change the career pathways and just whole social emotional development and advancement for the students in our community, particularly in North Tulsa Public Schools. This event today, we started with just a little mixer. We're going to move into a presentation, and after the presentation is given by Tuesdai Johnson, we're going to have just a quick little panel. The panels, they're going to introduce themselves when their times come, but just start thinking of just some questions just to get a discussion going for us to continue to jot down and be intentional about how we're moving forward in this initiative, how we're serving our kids, the purpose of art therapy, how it impacts our community as a whole, and just ourselves individually. We want to make sure we always think about it at Art Forms, what are we putting in our bodies and what are we allowing our bodies to experience? After that Q&A portion, we're going to move into the art therapy pod experience. So we'll be able to take in probably about 3 or 4 people at a time, where you can go inside of the world's first art therapy pod to experience this beautiful design and impactful piece that our students will be able to use and community members. After that, we would love if you could take a gallery walk if you haven't already done so, just to learn a little bit about Art Forms. You'll see those posters around the room on some of the easels. And we would also like to do a call to donate to the cause and also just to volunteer your time. It doesn't always have to be actual money. It could be, you could spend your time with us and some of our programming that we have throughout the academic year. I wanted to start before transitioning over to Tuesday's presentation, just to let you all know that Oklahoma ranks in the bottom 10 states in the nation for child well-being. That was reported in 2020. The overall ranking 45 out of 50 states, and ranked 48th in education. Those are hard numbers to hear, but it's really our reality, and that's one of the reasons that we are here to change what that looks like, because the student to prison pipeline is really real for our black and brown kids and just our public school students in general in our city, in our state, and around our country. And no state has lost more education funding than Oklahoma in the last decade. As a result, almost 2,000 fine arts classes have been cut. So that just tells you a little bit, just a little bit about why we're here. And Art Forms, our mission and our vision is to be able to continue to provide that free arts and wellness education and resources to make sure that we create successful and very good individuals for our community and just for our families. And I don't want to be too long-winded. I want to introduce now our main presenter while we're here. She's so amazing. Ms. Tuesdai Johnson. Can we give her a hand for Tuesdai? I'm going to take us through a wonderful presentation, and you'll see me just a little later. Do you want this or the clicker?
The clicker.
Oh.
Oh, wait, so I'm going to have to project? Okay, yeah, I need this. Thank you. Hello, and good evening, everyone. It's a pleasure to be here with you guys talking about something that is really purposeful and meaningful to me. Oh, is it not on? Hello? Testing. Can you guys hear me now?
The music. The music.
Hello? Can you guys hear? Oh, there we go. Yeah, okay. Well, good evening again, and it's a pleasure to be here with you all to talk about something that's really important to me, something that's really near and dear to my heart, which is art therapy in the schools, working with BIPOC students. We still good? Okay. All right. So I want to thank Ebony and the Art Forums for having me. Here. Again, it is a pleasure. But I'm not going to spend too much time here. I just want to jump into because this information is really important and significant. So I'm going to share with you guys just a piece that I created that's really a pivotal piece in my life because it did help direct the trajectory of my life in terms of the work that I'm doing right now. So this piece is titled Clarity, and I'll just read this little blurb here. Clarity was rooted when a life of blur no longer outweighed the risk of societal persecution. Clarity has grown in the opportunities and accomplishments and will flourish when fears are faced. Clarity stands as a reflective reminder of the journey to becoming. So as Ebony mentioned, my name is Tuesdai Johnson. My pronouns are she and her. I'm currently a registered art therapist and a licensed resident in counseling, pending licensure this year. I'm also a business owner, a published author, and an artist. All right, guys, so this is just a brief overview of what my presentation today will cover. So as you can see, we'll talk a little bit about art therapy and its impact and what its impact can be in the schools, as well as what art therapy looks like with children and adolescents in both the residential juvenile detention center school as well as private practice. And I'll lastly share with you a little bit of my social justice efforts since graduating. So what is art therapy? This is a question I get asked all the time, literally all the time. And according to the American Art Therapy Association, and I am not going to read this long, lengthy definition to you all. I will invite you all to do so, and I will direct you to the underlying parts, as these are the main areas in which art therapy can be impactful in working with the BIPOC students here in Tulsa. So art therapy can effectively support personal and relational treatment goals as well as community concerns. It can improve cognitive and sensory motor functionings, foster self-esteem and self-awareness. It can cultivate emotional resilience, promote insight, enhance social skills, and reduce and resolve conflicts and distress, and advance societal and ecological change. What does all of this mean? To put it simply and plainly, art therapy is a mental health profession facilitated by trained art therapists where art is used as a vehicle for self-expression when words are not available or desired. So the impact of art therapy, specifically in schools, art therapy can help individuals, students specifically, express themselves more freely. It can help with mental health and interpersonal relationships, Now, in terms of art therapy, there are 3 different methods. Oh, sorry guys, y'all gotta let me know because I will just get comfortable and let this thing drop. So there's 3 different methods for practicing art therapy, and I'll invite you all to look at all 3 of them. However, I do want to really pay a lot of attention to art as therapy, as it seems to be the most impactful in working with students in the schools. When using art as therapy in the schools, there isn't a lot of focus on art in terms of the meaning of it. It's more so focused on the process of art therapy. So we don't necessarily care about the aesthetics of art. It's more so, how did we get here? And that really drives the work of working with students. And I'll share with you guys, in terms of working with BIPOC students, it's a really guarded population. There isn't a lot of self-disclosure. It's uncomfortable. They don't like it. And so if we focus on the art, it takes that away from them. So in the schools, there are certain things that are important in terms of what art therapy can offer. So again, I am not going to read all of these. I'm going to pay attention to really specific ones that I think can really be impactful in terms of working with BIPOC students, which I'll invite you to look at the last 3. So art therapy and working with students can assist in development of healthy coping strategies. Our students have a difficult time with expressing themselves, with regulating their emotions. And so if we can offer them healthy coping skills through using art, I believe, and I have seen firsthand, improvement in behavioral issues. And I work in a juvenile detention center, so suspension isn't necessarily a thing there. but I do believe that it can decrease the suspension rate in public schools. And next, I want to focus a little bit on empathy. So I don't know if you guys have been aware, but our youth seem to lack empathy in today's society. I don't know what has contributed to it. There's probably multiple reasons, to include social media influence, peers, environmental concerns, and maybe even culture. So what art therapy can do in terms of influencing empathy is give students the awareness, the knowledge, the language to really become more empathetic in terms of how they interact with their peers, their community, and even their family. Now, the last one is really important, and I'll share a little bit more about this as I talk to you about my experience working in juvenile detention center school. But social emotional learning is of the key importance in terms of working with students in the BIPOC school setting, well, in school settings, but specifically with BIPOC students. It can also improve physical development. And again, I'm going to share a little bit more about this as I talk to you guys about my personal experience working in a juvenile detention center with BIPOC students. Okay. All right. And there are other reasons as to why art therapy, sorry, y'all gotta let me know, please. Thank you. There are other reasons as to how art therapy can be impactful in the schools, to include, again, I just want to focus on the highlighted because I've seen this firsthand as to how impactful it can be. So I'll invite you to look at the underlined area. Students are often discovered silently struggling with anxiety, depression, social difficulties, and low self-esteem. In part, I think this has to do with language. I don't think kids necessarily know what anxiety looks like and feels like in terms of a general diagnosis. And so in terms of the work that I've done with kids, it's mainly identifying what anxiety looks like. So heart palpitations, sweating palms, racing thoughts. And so in terms of working with the students, I think if they're able to identify these things, they can communicate what they need in the moment. And in terms of depression and societal difficulties, as well as low self-esteem, all of these things in terms of art therapy can really influence the way that students show up in the day-to-day. So, art therapy with children and adolescents. I really want to be specific to let you guys know what art therapy looks like in terms of children. So this age range is normally between 5 and 12. It's not specific to age 5. However, as we talk about public schools, most kids enter this public schools at the age of 5. I do know and have colleagues who've worked with students who are younger than that, but in terms of my expertise, 5 is as low as I can go. And so some of the presenting problems that I've noticed in terms of students, specifically with the impact of the global pandemic, include anxiety, depression, adjustment disorder, PTSD, and I'll say ADHD to be specific, which can be overdiagnosed. And then in terms of adolescence, that age range is normally between 13 and 19. And those, I would say, also have similar presenting problems, especially with the global pandemic, to include anxiety, depression, and I'll say ADHD and also PTSD. I think the pandemic has really exacerbated these due to isolation and the virtual learning experience that our kids have been subjected to. Okay. So I'm not sure, and I do want this to be somewhat of a conversational piece, but how many of you have an understanding of what a residential behavioral center is by show of hand? Oh, the art therapist. Okay, well, what a residential center is, it's a treatment center where kids are housed there for between maybe 4 to 6 months at a time. And they are provided individual therapy, they're provided group therapy, and family therapy. Specific to my experience, students normally attended individual therapy twice a week. They attended group therapy multiple times a week, depending on what groups were available, and then family therapy met once a week. So I want to share one of my successes in terms of residential. I'll direct you to the middle area with the children population, the emotions, Pokemon characters, and balls. This was really impactful in that it really allowed the students to be present with their emotions. It wasn't necessarily identifying each of them, but we used characters as a way, art as therapy, right, to identify what defense mechanisms and coping skills would be impactful for the character. Essentially, the characters were a representation or could be a reflection of the student themselves, but the discussion surrounding this was really important and impactful. It allowed the kids to connect on a different level. It made them feel open because they weren't the only one who had this Pokemon character with defense mechanisms and coping skills. And so to see them interact with one another and be so open, you could really tell that they were getting into it but also benefiting from the work. And just to save time, I'm not going to get into all of these art interventions because I could be here all day. I really enjoy this work. Okay, by show of hands, how many of you guys are familiar with juvenile detention centers? Yes, okay, better than the last one, okay. So I worked in a juvenile detention center for close to 4 years, where majority of the population were BIPOC students. And I'll just kind of paint a picture for you guys of what this looked like. So imagine a juvenile detention center and a public school housed within it, reflective of maybe a hallway, so to speak. Most of the students, I will say, were African American. There were few white students, but mostly it was hugely black and brown students, to say the least. But what I really enjoyed about this work is the flexibility. Because no one knows what art therapy is, it allowed me to kind of just do what I wanted to do without having to explain myself, which is really important working as an art therapist. You have to be flexible. I could plan a lesson plan and think it was like top tier. But if the students come in and they need something different, it doesn't matter how much work I put into that lesson plan, I'm going to have to shift gears to meet the needs of the student in that moment. And so that's something that I really valued in terms of working in the school system. How do you grade art therapy? You can't. You show up, you do the work, you get an A. I mean, that's essentially what it was. But again, we did pay attention to social emotional learning, so that was how I guided or directed the lesson plans. And I want to share with you guys something that was really significant in my time working at the Juvenile Detention Center, which was the Love Lock Bridge, which was similar to that of the one in Paris. So for February, the character traits are compassion, love, and kindness. I think there's a fourth, but it's been a while since I've worked there, so forgive me, please. But essentially what the students did, as a community, they created a gate out of plaster, paint, and I feel like there was something else, but I can't remember the last ingredient. I forgot. Something to support it, yes. I can't remember exactly what we used, but essentially they created this long gate, and I wish I had a picture, but unfortunately you have to have consent to take pictures of the work that they did there, and I didn't have that. But each student was told to identify 3 goals that they wanted to achieve or accomplish outside of detention, because we didn't want them to be, I didn't want them to be so focused on their current situation, because, I mean, it's not the trajectory, or it doesn't have to be the trajectory of their career. So I got them to identify 3 goals, and they created little locks. And on those goals, they represented, they used imagery to represent each of those goals, and they attached them to the gate. And so as they were talking, I'm sorry, I really loved working with this population. But as they started to talk about their goals, you could tell that it moved them into a future-oriented mindset. You heard goals of wanting to be in real estate, wanting to go to college. These were things that I don't necessarily know that they would have thought could have been an outcome for them, but it really had them thinking and had their wheels turning. And so again, one of by far the best art interventions or processes that I had at detention. And earlier I mentioned a little bit about how behavior can change due to the influence of art therapy. Well, I'm going to share with you about student council. You may not believe it, but a lot of the students in detention were interested in student council. So we really created ballots. We had them vote, nominate each other. And this was, of course, guided on the principle that they were able to behave, and they were. And they really enjoyed this process. So just to see the mindset shift through to the work that I was doing with them, it was really rewarding for me personally, but I know that it really impacted them because as I left, they were sad about not being able to continue it, unfortunately. So this brings me to the work that I'm currently doing, which is private practice. By show of hands, how many of you guys are knowledgeable of private practice work? Yes. Okay, we're doing good, guys. So private practice is a little different from the juvenile detention center school, but also a residential center in that I'm not going to say the kids are willing because parents definitely bring them, but they're more likely to participate in art therapy in a private practice. Some. But in private practice, I currently provide therapy to individual and adolescents as it pertains to school. I actually provide it to everyone right now, but we'll focus on these two. And I'll share with you, with the children population, a lot of the work that I'm doing with them, again, is helping to regulate emotions, but also identify their emotions and to identify coping skills to help them regulate. So this can be seen in an example or art processes as superpowers. Like what superpowers would you have if you could have any superpower, and allowing them to really be creative with that directive. But also anger monsters. And how do we calm down the anger monster? How do we soothe the anger monster? So the kids love these. I'll tell you, as an art therapist working with children, you really have to have an imagination because they definitely do. And then in terms of adolescents, this is something that we'll actually practice today. Grounding hand tracings, but also Zentangles, both which can help with becoming grounded, which is being more so present in the here and now. As I mentioned earlier, anxiety is one of the more presenting problems currently, and that's kind of more so being worried about the future. But we want we want students to be present more so in the here and now, because that's essentially what they have control over. Social justice. All right, guys, so this is going to be brief because I do want to allow you guys time to really work on the art exercise, but I'm really excited to share with you some of the social justice efforts that I've taken, or steps towards social justice, since graduating from grad school. The assignment. This is the thing that changed it all, essentially. So early on in my art therapy education, we were given a task to identify a quote from an art therapist. Essentially, I wanted an art therapist of color because I'm an art therapist of color. But I'll share with you that it was the most difficult task I'd ever had. Finding a quote from the first person to receive a doctorate in art therapy seemed impossible, more so like a needle in a haystack, which I couldn't believe. I had peers, cohort members that would tell me just move on and find someone else. But because I was so, let me be professional, but because I was really motivated to find a quote from an art therapist of color, I really utilized my resources to help me find exactly what I wanted. And so here is a picture of the final outcome, but also this quote from Dr. Lucille Venture. So in her dissertation, she wrote, "Art therapy historically has its base in Freudian theory. The major significance of this theoretical model to application of art therapy is its exclusiveness. Traditionally, art therapy, like other therapies, is not for the masses, is not for the poverty-stricken, is not for the blacks." False. And in fact, her dissertation proved the exact opposite. her work really centered around the impact that art therapy can have with Black and brown students specifically. So from that assignment, really navigated my current career path in pursuits of social justice. So after that assignment, it kind of influenced my capstone project and my thesis, which was the graduate school experience of art therapy students of color. So this was a research study or pilot study that I did where I interviewed BIPOC students of color who attended a predominantly white institution. Just to understand what their experience was like and to see how they can be assisted or aided in their what's the word, guys? Yes, research. But from there came 2 publications. The first one being Art Therapy Students of Color, the experience of 7 graduate students, where it was really more specific to those 7 students interviewed from the capstone. And outside of art therapy education, I've really connected with the BIPOC circle of art therapists to include all types of ethnic and racial backgrounds, in which we have really taken a mission and initiative to undo the racist work that is so intertwined throughout our educational system. And so the virtual circle, I will say, has been something that really helped me in terms of being an art therapist of color, as it allowed me to know that I wasn't alone, that I had support, and I had community and connection. And from them grew this business that I also started, which specializes in BIPOC, which is the acronym for Black, Indigenous, and People of Color's mental health and wellness, providing individual and small groups mentoring, as well as brief mental health services, and the most important thing to me, workshops and trainings to improve diversity and inclusion in mental health education. I say that because there is not a lot of diversity in art therapy, and I feel like the way to grow that is to meet them where they are. So if we can support the BIPOC mental health students, then they can essentially go into the community and continue the work that has already begun.